For these basic lessons, your patient's incision should run from left to right in front of you. Things spay incision and how a patient is placed on the surgery table. Remember, you will not be able to move your patient during the lesson since you cannot rotate your patient on the surgery table. Tissue forceps will be held in your left hand using a pencil grip. Your right hand will hold the needle holders with your thumb and ring finger inside the finger rings. Your pointer finger will extend forward. This will help stabilize your needle holders as you push the needle through your tissue. The tips of your needle holders will be used to grasp your needle approximately 2/3 of the way along into the body of the needle. Your needle will be perpendicular to your needle holders. Let's review some terminology. A bite is the act of pushing your tissue or your needle through tissue. That is a bite. A throw is when you align your needle holders between the tail of your suture and the needle of your suture. You will wrap around the needle holders once with the suture, grasp the tail, and pull it through. That is a throw. A knot consists of 2 throws. So you will realign your needle holders, wrap around one more time, grab your tail, and pull it through. This is a regular knot. You will hear us refer to something called a surgeon's knot. A surgeon's knot is basically the same thing as a regular knot with one minor difference. You will take your bite and pull it through the tissue. You will realign your needle holders, wrap around once, and then you're going to perform a surgeon's throw, which means you're going to wrap it around twice. Grasp your tail and pull it through. Now remember, this is a knot, so you actually need to have 2 throws. Your second throw, you will realign the needle holders, wrap around one time, grasp the tail, and pull it through. This is a surgeon's knot. To make a secure knot, you will need at least 2 knots, a surgeon's knot below a regular knot. Let's move on to doing a vertical mattress suture. A vertical mattress suture consists of 2 bites and is called a near, far knot. So you're going to start off the same way that you've done your other knots. You're going to start on the side of the incision away from you, and then you're going to bite through onto the close side of the incision. Now, as we started this, you were holding your needle in your needle holders with the point coming towards you. This is a very natural position for your wrist. We're going to reverse that direction for your next bite. So now, your needle will be facing away from you. And that is because we're going to do the far as part of our second bite. So we're going to move backwards about 5 millimeters from the exit point of our first bite. Then we're going to exit about 5 millimeters behind the entrance point of our first bite. And this is what you're going to wind up with. Okay, I smoothed that out just for you to see. Living tissue is not going to have to be smushed down like this. Here's your incision. Your near of your first bite. Your far of your second bite. Now we have to place our knot. So as you can see, the tail of our suture and the needle end of our suture are adjacent to our incision. This is why you learn to place the needle holders for your throws between the tail and the needle and not follow along the incision. So align your needle holders between the tail and the needle, wrap around twice because we're going to do a surgeon's throw first, grasp your tail and pull it through. You're going to notice that this is a nice little line here. If when you pull it through it looks like a little wonky mess like this, that's headed for a granny's knot and is incorrect. So you want to make your surgeon's knot, realign, so surgeon's throw, realign your needle holders, wrap the suture around once, grab your tail and pull it through. You now have your surgeon's knot. Let's place that second knot for security. So wrap around once, align, wrap around once, and now you have a more secure knot. You also have your knot on the opposite side of your incision. Let's do that again. Hold your needle so that it's pointing towards you. Move over. In this case, I'm going to move over about a centimeter, just so that you can see better. Entrance point, near. Exit point, near. I'm going to turn my needle around so that it's facing away from me. I'm going to move these over just so that you can see a little easier. I'm going to do my second bite far, far, and my exit point is going to be far also. Again, I'm using my tissue forceps to kind of flatten things down so you can see better. The tail and the needle are on the most distant side of your incision. Align my needle holders between the tail and the needle. Do my surgeon's throw, which is twice. Grasp my tail and pull it through. Realign my needle holders. Wrap around once. Grasp my tail. Pull it through. Let's finish that off with a secure knot. So I'm going to do 2 more throws. 1, 2. All right, let's do that one more time. Place the needle so that it's facing towards you. I'm going to go near. Bite 1 is near. Entrance near. Exit near. I'm going to turn my needle around. And I'm going to place the second bite, which is far, far. So far and far. Okay. Make sure everything's lined up so that you can see. Align my needle holders up. We're going to do our surgeon's throw. Grab my tail, pull it through. Align my needle holders, wrap around once, and pull it through again. There's my surgeon's knot. Let's do a regular knot on top of that. And a regular knot, or a regular throw. Okay. Now if you notice, you have little lines on either side of your incision. You will want to have your entrance and exit points evenly spaced along your incision. You're going to want your exit points evenly spaced along your incisions. And you will want your suture patterns evenly spaced along your incision. Your knots will be on the same side, usually the far side of your incision. And it's going to look like a bunch of little pluses. So here is your incision. Here's 1 plus, 1 plus, 1 plus. And that is your vertical mattress suture.